So thanks everyone for joining today. My name's Ella. I'm the Senior Project Officer at Gold Coast Primary Health Network, working in the older persons project space in the special projects team. So we have a number of residential aged care facility projects and palliative care projects. This includes the wound care project and also our telehealth grant, which I'm hoping that you've seen available. So we'll just go through some housekeeping, and before we start, I just want to acknowledge and pay respects to the land of the traditional practices of the families of the Yugambeh language region of South East Queensland, and their elders past, present and emerging. So I'll just get everyone to keep your microphones on mute, and I'll just call out when we are opening up to some questions, and please just turn your unmute and feel free to ask questions through the chat as well. So this is being recorded and it will be up on the website, and that will come up on the website in the next few days. So we're going to go over what the grant background is and how it aligns with the Royal Commission into Aged Care quality and safety findings, and we'll go across how to apply for the grant and the grant terms and conditions, and then we'll allocate some time for questions and answers. So I'll just get you to hold questions for now until I go through the information, so that I might cover it as I'm going through. Some background on the grant. The Gold Coast Primary Health Network and other primary health networks across Australia. So Gold Coast Primary Health Network are one of 31 primary health networks in Australia. Primary health networks have received funding to support the Royal Commission into Aged Care quality and safety. One of the issues that came out of the Royal Commission was the complex issues being faced by residents, including access to the lack of access to primary healthcare professionals. So when we talk about primary healthcare, that includes allied healthcare professionals such as physios, and it also includes our general practitioners. Now, the Department of Health, through the Department of Health and Aged Care, they have provided funding to support the increased implementation of telehealth facilities, equipment, technology and training. And this aims to better support our local residential aged care facilities to support residents to access that primary health care through virtual appointments. So the aim of this project is to support you and your staff and your residents at your facility to have adequate virtual consultations and technologies for your residents so that they can access that telehealth with their primary healthcare professionals. So the objectives of our grant is to support participating residential aged care facilities to have that appropriate telehealth facilities and equipment, to support your residents to have those virtual consultations with your primary healthcare professionals, specialists and other clinicians. And participating residential aged care staff will also be supported with some training to help increase confidence and knowledge around best practice telehealth and how to access virtual consultations. So for those participating in the grant, there is a requirement to support that training and education, and that will come later in 2023. We'll share some information about that. So we do hope that through this grant project that RACFs will increase access to that clinically appropriate telehealth for residents. So that includes using video consultation instead of just phone when it's appropriate for telehealth, that they'll have increased access to healthcare professionals, and that staff will have increased confidence in using that telehealth equipment, and the opportunity for carers and family members to be included in those appointments through the use of telehealth. So I'm just going to play a quick video which showcases the Hunter New England Primary Health Network in New South Wales and how some of their facilities utilise the grant So this might give us just some ideas on how your facility might use their funding to improve access to telehealth.
I'm Janine Cole. I'm the Group Manager here at Northern Coalfields Aged Care Facility. We currently have 139 beds within the organisation. That goes across 3 aged care facilities. We were happy to engage with the PHN to be involved in the Telehealth project because we have worked with them before, and knowing the support that's behind that, and also assisting us engage in getting the GPs on board with using the telehealth program. The other main reason we wanted to be involved is to reduce the time frame for clinical review for our residents. And also during the COVID outbreak, we had GPs that were unable to visit. This provided a platform that they could actually review the residents. It also provided the opportunity for wound reviews and seeing if anyone had any infections.
The primary goal is to be able to provide symptom management and address someone's needs in a timely manner. The ability to use telehealth allows me to be able to assess somebody at any time of the day, any day of the week, and it allows reduced suffering for people and fast intervention into the management of their symptoms and needs.
The telehealth's improved the access tremendously in that we've, particularly during COVID, that we've actually had the GPs able to engage in that, and also our nurse practitioners. So some of our GPs ask our nurse practitioner to do the initial assessment. There's a lot more benefits with using the mobile telehealth system. It's been fantastic for us. It's easy for the staff to use. It's mobile. We can actually take it to the resident's room. It has a removable camera, so we can actually get it closer to get better pictures. It's got 2 screens, so we can actually see what's happening on our side as well while we're manipulating the camera. It's got very good speakers, so it's very easy for the residents to actually hear what's happening. Everything's there easily to document and everything while you're there. It's all done in the one area.
I'm able to do my documentation immediately if I require any support from other specialist services. I can link in with them and they can join the consultation. Also, if I was needing to do a script, I can do all of that at the bedside and forward that on to our pharmacies.
We have actually done case conferences on there as well and used with families, so I just think there's so many areas that it can be used besides just with the GPs. It's a device that can be used for telehealth, but also other options as well. It's actually saved time in travel, plus the waiting time for the GPs as well. So it has stopped some admissions to hospital, which obviously takes up ambulance resources. It uses the resources at the hospital. Hospitals also increase the risk of infection for our vulnerable people as well, being in an unfamiliar environment, particularly if they've got a cognitive impairment. So there's a lot of positives for them not to be transferred out and using resources that aren't required, so it certainly has helped.
I would encourage everybody to take up this valuable resource. I think that when you have any new introduction with technology, be prepared. Be patient. It doesn't take very long for your confidence to grow and you realise how much time can be reduced and how many more people you can see, service and meet their needs and have great patient outcomes in a really timely manner. I would encourage everyone to take up this fantastic opportunity.
Okay, I hope that gave everyone a good idea of and a visual representation of what the grant could look like. So I'll just call out some things that you might have noticed there in the video. So there was the telehealth trolley that the facility had purchased due to the barrier of having a separate room for telehealth. The trolley allowed residents to stay in their room and the telehealth equipment to be wheeled around to the resident's room. So that's one idea that the grant can be used. I have spoken to a few facilities that have sort of highlighted, oh, we've got iPads or we have laptops already. So I think on the telehealth trolley, you'll notice that the nurse was able to complete the consultation notes during the telehealth because she had an additional laptop that allowed the primary healthcare provider to be connected for the video telehealth consult. Meanwhile, the staff member was able to take notes at the same time. And also the camera there as well that was used to be able to show, for example, spots on the resident's foot there. So I think there's some great ideas if you're unsure what you could use the funding for. That was a great representation. If you are wanting to find that video, it is up on our website, and we can send the link out to that afterwards. So you'll see here what can be purchased with the grant. So I've just included some ideas which you would have seen in the video. And you can also look at things like those remote patient monitoring devices like the camera, and as well as software licenses. Many facilities have discussed about their internet and their Wi-Fi connection being poor, so internet network boosters to place throughout the facility to boost that Wi-Fi. That's something else you could use the grant for, as well as labour costs to install the equipment is just something to consider. Okay, so how to apply for the grant? So consider what equipment and technology would assist your facility. And in that, just consider what barriers that your facility currently has for supporting the facilitation of video telehealth. Complete the Word application, which Kirsty has popped in the chat for us earlier. She might have popped that in there now. So that Word application has examples of how you can respond to the question. So it's made it really easy. There's 5 questions and they all have an example there. So you can use the example as a template and then just edit them to be specific to your residential aged care facilities. So this is due on the 30th of January. So Gold Coast Primary Health Network will notify successful applicants within 14 business days and request an invoice. We can send you a template of the type of invoice that we require. And this invoice must be returned with a mandatory baseline survey, which takes around 5 minutes. And then your facility will receive the funding. So we anticipate that that whole process will take around 30 minutes to complete the application form. So I'm not going to go all of the grant terms and conditions. They are on our website, but most of them are fairly standard to what grant conditions usually look like. But I just didn't want there to be any surprises there. So I've just called out that any unspent funds should be communicated with Gold Coast Primary Health Network, and we will work with you to come up with some strategies if there's any other equipment that could support your facility to spending that amount. We really want facilities to utilise the full amount of funding. We want to support your facility increase telehealth and consider what would benefit the residents. So we will work with you to spend that funds. But if we can't find a way that would be beneficial for your facility to utilise it, it would have to be returned to Gold Coast Primary Health Network. And we do require a 1-page acquittal report before the 30th of June, including what was purchased with the grant. So that just means keeping receipts when you are making those purchases. The other condition, which is probably unique for this grant, is the training. So we do have a minimum requirement that at least one RACF manager and one nurse is required to participate in a training opportunity provided by Gold Coast Primary Health Network. So we're looking at approximately 1 hour, but we will share some more information on that training in the coming months. And then for the survey participation, we have a pre-survey, which takes around 5 minutes, and a post-evaluation survey, which takes around 5 to 10 minutes. So that pre-evaluation will help us measure how the grant has helped your facility, we hope, by when we complete the post-evaluation survey. So we'll sort of get a baseline of what telehealth looks like in your facility currently. And then at the end of grant funding and in June, we'll send the post-evaluation survey to help measure that change and hopefully provide some good news stories to how the funding's helped your facility. So just to reiterate key dates, so the applications are due on the 30th of January. If you do need an extension, please just reach out and we can work with your facility to help support that application. So invoices, once we have approved your applications and that you've completed the 5-minute mandatory survey, we do require that invoice within 14 days. And the acquittal report, that one will be due in June, along with the post-evaluation survey. So this is just an example of what that acquittal form looks like. So it is really simple. We will give you an example of what we do require. So it isn't anything that's going to take too long. It's just keeping those receipts throughout your purchasing period that will help that process. So just with the applications that we have received so far, I've just popped some frequently asked questions that we've had throughout the application process. So do I need to know exactly what brand of equipment I'm going to purchase prior to applying? So all we ask in the application is that you have a plan of what you're going to expend the funds on, but we don't require you to list each brand. Just have an idea of the total amount of costs of that equipment, but it doesn't need to be an exact amount, just want a rough plan. So if we have more than one facility on the Gold Coast, can more than one site apply? So yes, grants will be allocated per each site, not per organisation. And then if you do change your decision and you purchase something different to what was originally in your application, as long as it meets the grant requirements, as long as you're not buying personal equipment for yourself or something that won't support telehealth, then that's fine. You just need to keep those receipts and report on that in your acquittal process. So a key example of that is if initially you were going to buy a telehealth trolley and then decided that actually no, I'd prefer to purchase iPads, that's totally fine. You just need to include that in that final acquittal report. And then for those facilities that have partner organisations in other areas such as Brisbane, it is only for Gold Coast facilities that are eligible for this grant. So please just ask those RACFs out of the Gold Coast area to contact their local PHN. We've included our email there and happy to help connect other sites to PHNs in other areas. Okay, so the application form is in the chat. So if you want to open up that link and just have a scroll through it, and if there are any questions, it's a great opportunity for you to ask them now. If you are wanting any guidance on that application process, please feel free to unmute yourself and ask any questions. Harpreet, I know that you were concerned around this service replacing the space team, which you said earlier. Does that sort of make sense there around that this is not to replace any healthcare professionals, it's just to support residents to access other services?
Yeah, I just realized after that now. Yeah. So anyway, it was informative information. So thank you very much.
That's okay. Did you have any questions about your facility?
No.
No. Okay. Great.
Thank you very much.
No worries. Please send through any questions via email, or if you want to have a go at the application form and send it through, we're very happy to work with you on that application form. So we promise we won't just reject it. We'll definitely work with you if it requires further information. I'll hang out here until 12:30. So if you don't have any questions, feel free to drop off. But if you do have questions, please unmute and ask away.